This is Real History with Melissa, and this is another installment of the COVID-19 timeline by Mike in Canada. This is March 2020. And Mike has given us an opportunity to just go back in time, look at the event as it unfolded. What were we supposed to see? How did the media present this to us? And there's no commentary, there's no spin from me or from Mike or anyone telling you what you're supposed to think. It's just the news coverage of the event. And this is one thing that Alan Watt would say about things like presidential debates or any event that happened. You've just seen, for instance, a presidential debate, but now you have to have the news pundits, the experts that sit down and tell you what you're supposed to think. And as COVID-19 unfolded for us in real time, that is what we all lived through. Experts came out and they told us what to think. And then other experts came and they disagreed. And the beauty of something like this is we get to watch it and come to our own conclusions. And in some cases, hopefully, we can rethink things that we thought, because we can ask ourselves, do I really think that? Or was that implanted in my mind by an expert? So enjoy March 2020.
Almost 87,000 people infected with the novel coronavirus around the world, and the global death toll nearing 3,000. On Sunday, China reported 573 new cases overnight, the highest daily increase this week. That brings the number of confirmed patients in China to over 79,800. 35 more people died from COVID-19 as of Saturday, meaning a total of 2,870 people have died from the virus in the country. The virus continues.
From big box warehouses to neighborhood drugstores, Americans are preparing for a pandemic.
It's hard to find. In fact, I've got like 4 back orders out there for masks to come in.
I'm just concerned that people are going to start panicking and they will start stocking up on some of the medications.
Officials say risk of coronavirus infection is still low, but because so little is known about exactly how many people are infected or just how dangerous the virus is, the anxiety index is climbing.
It's really extraordinary that from the first time the sequence was made public by the Chinese when they discovered what virus it was, literally within days, we took that sequence off the database and inserted it into one of our vaccine platforms called the messenger RNA in the Vaccine Research Center at the NIH. The phase 1 trial is 45 individuals. Phase 2 trials are hundreds, if not a couple of thousand individuals. It would take then about a year to a year and a half to be fully confident that we would have a vaccine that would be able to protect the American people.
The robot will make its rounds in the 2 isolation wards there, allowing healthcare professionals to inspect patients remotely. They will make use of the robot's camera and eye-safe laser pointer to observe and make diagnosis.
How are you feeling, Dave?
The viral wave from China now seems to be cresting as it surges west.
Italy, Iran and Britain all recording their single biggest daily jumps in coronavirus cases. With 100,000 infections globally now, the chief of the World Health Organization is calling on all nations to make containment the highest priority.
This is a time for pulling out all the stops.
Vietnam reported 3 more COVID-19 infection cases on March 7th afternoon. The Ministry of Health said of the infection cases, 2 are related to a female patient confirmed to be infected with the novel coronavirus a day earlier. The 2 patients include a 64-year-old woman who's the female patient's aunt and a 27-year-old man, the patient's driver.
Will create inconveniences. We understand that these measures will impose sacrifices, sometimes small and sometimes very large. But
Venice, one of the affected cities, tourists were largely absent from the normally bustling areas. All major gatherings will be halted under the new restrictions. Gyms, museums, ski resorts ordered to close. Weddings and funerals will be stopped as part of the measures, which will last until early April.
Ohio Health has 85 inpatient negative pressure rooms designed to draw air in from the hospital but force air out to eliminate the risk of spreading the disease to any other rooms or common areas of the hospital.
It has its own dedicated exhaust system, and it is exhausted at the top of the building, but only after it goes through a special filter that filters out 99.97% of anything in the air.
A depressing and now familiar pattern. Elderly with underlying health conditions. The 6th and latest UK coronavirus death, this time coming here in Watford. The rising numbers have today again prompted questions about Britain's capacity to cope.
Well, of course we have to plan for a reasonable worst-case scenario, but we're working incredibly hard to avoid that scenario.
WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
This is an issue that the whole world is grappling with, and so we felt like it was our moral obligation to offer testing to as many people as we can.
Dr. Matthew Binnicker oversees Mayo Clinic's laboratory response in developing a test to detect COVID-19 in clinical samples. A process that usually takes 6 months to a year was accomplished in under a month, thanks to a dedicated team working around the clock.
It has been a heroic effort and a team effort.
We're thinking about all the families across the country who've received the same diagnosis. But we're in good hands. We have full confidence in Canada's health officials and professionals. This means that upon my doctor's recommendation, I will remain in self-isolation for 14 days. I want to be clear, I have no symptoms and I'm feeling good. And technology allows me to work from home.
Today, Canada's biggest university, along with many others across the country, made the decision to cancel all face-to-face classes and move them online.
I think it's a pretty good idea. Social distancing is pretty important right now to contain the virus.
There's a lot of repercussions of this decision that are definitely a little bit stressful in terms of labs and midterms and finals.
Governors in 19 states and Washington, D.C. have closed schools. The National Guard is now active in a growing number of states. Businesses are shuttering. Last night, airports from Chicago to Dallas to New York jammed with Americans trying to come home.
I have just enacted an executive order to activate the National Guard.
A state disaster for all counties in the state of Texas.
We will close all K-12 schools.
On Friday, the president declared a national emergency.
A national emergency. 2 very big words. The action I am taking will open up access to up to $50 billion.
Across Canada, empty streets, closed businesses amidst a deepening lockdown. Schools suspended in all but a few provinces, visits to long-term care homes restricted, and elective surgeries postponed. all necessary measures, says this expert, and timing is everything.
If you're going to do social distancing, you need to do it for real, and you need to do it early on if you're trying to control things.
Thank you for that question. The vaccine candidate that was given the first injections for the first person took place today. You might recall when we first started, I said it would be 2 to 3 months, and if we did that, that would be the fastest we've ever gone from obtaining the sequence to being able to do a phase 1 trial. This has been now 65 days, which I believe is the record. What it is, it's a trial of 45 normal individuals between the ages of 18 and 55. The trial is taking place in Seattle. There will be 2 injections, one at 0 day, first one, then 28 days. There will be 3 separate doses, 25 milligrams, 100 milligrams, 250 milligrams, and the individuals will be followed for 1 year, both for safety and whether it induces the kind of response that we predict would be protective. And that's.
I was asked to show the setup.
Giving us a look at his rural Ontario hospital is Dr. Alain Gauthier. He and his colleagues are preparing for a worst-case scenario, an overload of serious COVID-19 cases and not enough ventilators to go around.
I'd like to show you how to modify one ventilator to ventilate 2.
With the help of this video, Gauthier and his team retooled each ventilator to help save multiple lives.
At one point, we may not have other options. The option could be, well, we let people die, or we give that a chance.
50,000 Canadians died of Spanish flu out of an estimated 500,000 who actually contracted it. So the numbers, the math of pandemics is often scarier than the science because of the exponential way in which things spread. The comforting part is that one of the things we learned 100 years ago was that social isolation, early diagnosis, treatment to the extent that you can get it when hospitals are overcrowded or even closed, are effective.
We're getting grim new video out of Italy where the number of dead as a result of the coronavirus has surpassed China's numbers. We told you this could happen, and indeed it did happen overnight. And what you're looking at here, it's dark, but those are military vehicles near Milan. Soldiers called in overnight to transport the bodies of the dead from Milan to other cities and provinces because local authorities have been overwhelmed. Funeral homes, cemeteries, there's no more room. Just over 3,400 deaths as of yesterday, a jump of more than 400 from the day before. And that, as I said, surpasses China's numbers of dead. Very poignant clip out of Italy. A generation has died.
Worst day since the outbreak. Italy imposed further restrictions in a desperate move to halt coronavirus infections after the death toll increased by 793 in a single day Saturday. That's the biggest 24-hour rise recorded anywhere. In Italy, more than 4,000 people have died from COVID-19, surpassing China's death toll. The latest crackdown bans jogging and bicycle rides, the only types of outdoor exercise that were previously allowed.
Tonight, a massive rush to get tested suddenly cut short. Hundreds of people arriving before 4:30 this morning, waiting in a mile-long line at New Jersey's biggest drive-through testing site. But just 30 minutes after opening, they hit capacity, and police had to turn people away. Medical professionals now advise that only those with severe cases seek medical help.
The pandemic is accelerating. It took 67 days from the first reported case to reach the first 100,000 cases. 11 days for the second 100,000 cases. And just 4 days for the third 100,000 cases. You can see how the virus is accelerating.
As coronavirus spreads across the West, new signs of hope in Asia, and in particular South Korea, where there's been a dramatic turnaround. The number of infections skyrocketed there from dozens to thousands in early March. But now they're reporting the lowest number of new cases, just 64 in a single day, since their peak weeks ago. And they didn't lock down entire cities. Experts say swift action from the very beginning was key. That included social distancing, contact tracing, widespread testing, and they were prepared.
They made sure they...
Already, we have lost more than 16,000 lives. We know we will lose more. How many more will be determined by the decisions we make and the actions we take now.
In Revelstoke, BC, Zoe Purvis was shocked to see a party across the street and called the RCMP non-emergency line to report it.
Played a little bit on my heartstring just because I'm being so cautious. They either don't know or they just really don't care.
You have reached the COVID compliance tip line.
Some jurisdictions ask you to report by phone. In others, like Newfoundland and Alberta, it's an online report.
Do not call 911 unless there is an emergency that requires a response by police, fire, or paramedics.
I don't think it really is a snitch scenario. We're all doing it to protect someone that we know that we love.
New York is the most impacted state in America, and New York City is really the epicenter. The latest figures from New York Governor Andrew Cuomo show that more than 37,000 people have tested positive for coronavirus in New York State. More than 385 people have died in New York State. In New York City, more than 21,000 people have tested positive. More than 280 people have died, including a nurse in Manhattan and a transit worker, a subway conductor, to be more precise. New Yorkers are getting very anxious. They're mainly self-quarantining in their homes. I am doing the same thing. I'm standing in my front garden in a New York suburb.
Here are some of the key findings. 91% of the surveyed cities have a huge shortage of masks for first responders. 88% of them lack personal protective equipment. 92% cities do not have enough testing kits. And 85% have an acute shortage of ventilators. And that's not all. More than 60% of the cities are yet to receive emergency medical equipment from the state administrations. The U.S. needs 28 million masks, 7.9 million test kits, and 139,000 ventilators to absorb the surge in patients. Now,
looking at what we're seeing now, you know, I would say between 100 and 200,000 cases, but I don't want to be held to that because it's deaths. I mean, we're going to have millions of cases, but I just don't think that we really need to make a projection when it's such a moving target.
A research team at Oxford looked at how every country is using masks and says COVID-19 is an unusual case where masks can help because people who don't show symptoms can also be highly contagious.
And that gives you a full sense of confidence, but also it increases the touching of your face.
The conclusion here for now, wash your hands instead. Masks aren't worth it and could make matters worse. Salima Shivji, CBC News, Ottawa.
Nightmare in Bobcaygeon. This is normally a place that you associate with happiness, summertime, cottage country. Right now, it's the epicenter of the coronavirus, the pandemic. Over my shoulder here at the Pinecrest Nursing Home, we've lost 10 people. We understand it's 9 residents and 1 volunteer, perhaps a wife of one of the other people. But the watch is on for more people because there's many elderly people here. Obviously, with the coronavirus raging through this very small nursing home, it's all hands on deck. Not just for the people that are in the nursing home, but for the staff.